There are many factors that lead to skin problems, and I'd like to just focus on a few that we, the orthotists, tend to see in clinical settings. So, the first one being the improper fit of the boot and the bar. So, an ill fitting AFO can cause excessive pressures and frictions, leading to redness, blisters, and potentially sores, which is not, of course, what we want to see underneath the boot. So the question is the AFO too tight or is it too loose? Our job is to investigate that for you. Moving on to kind of things that we do see clinically is skin hygiene, and that can also contribute to problems. So following cast removal in particular, and at the onset of your first pair of boots, our first thought is to run home and just soak your cutie's foot in like the nicest little bubble bath they've ever had, just to get rid of that casting gunk and funk. But this is actually can contribute to skin breakdown. Think the Goldilocks rule, you don't want the extremes. So a clean, dry, and cool skin is the best under any orthotic device. Do not over moisturize the skin, and do not increase the bathing routine that your child has set. You will be the best parent, of course, knowing how frequently your child's skin does need bathed, but do not think that since they're in the boots and bar that their foot itself needs a bath every day. So whatever's best and for your child's skin otherwise, that normal bathing routine, that should be the same thing for the foot and ankles as well. The other thing is just skin moisture. So sweat and moisture can soften the skin, kind of make it a little bit pruny, and that makes it more susceptible to having breakdown or even fungal infections, which is obviously not great underneath there too. So tips for this concern is to switch out your cutie sock halfway through the day, or at a minimum, a new clean dry sock prior to your cutie's nighttime routine so that the skin can remain dry. Really, we're recommending just a sock that is full length of the actual AFO and super thin. That helps to allow the airflow to go through the sock because it is thin, and it covers the entire skin surface area that's underneath the AFO. Now, underlying conditions is kind of the last thing we see clinically that can be a little bit problematic with skin care underneath the boots and bars. So conditions like eczema can increase your risk of skin issues. So in this case, it's out of my scope of practice to really refer any sort of ointments or creams. So this is really when you need to recruit your pediatrician or back to your orthopedic physician for cases outside, again, of the orthotist scope of practice. So those are kind of the main things we see clinically that contribute to skin issues.